So I want you to think about how often you actually have a conversation about how to push out a baby. Whether you are pregnant right now or you've already given birth, really how often do we talk about this until it's actually the moment where we have to push out a baby? I know for me, for my first child, I didn't talk about the actual pushing at all until I was actually pushing. I talked about contractions and dilation and when to know you're in labor and so on and so forth, but no one actually taught me how to push the baby out. And then all of a sudden it was time to push and they're like, push, and I'm just like, time out. What am I supposed to do? And now I know that the instructions that I got in the hospital on how to push the baby out was absolutely wrong for me. Absolutely wrong. So in today's video, I'm gonna share with you from my experience as a mom of 4. I have a 7-month-old, a 3-year-old, a 5-year-old, and a 7-year-old. So I've given a lot of birth within a short period of time. I'm gonna tell you exactly how I learned how to push out a baby. My last time was the most successful because literally it was not painful. It wasn't, and so I want to share with you that insight so that maybe it will help you to be able to have the happy, positive birth experience that you're looking for. If you are new here, my name is Brittany Kelly. Like I said before, I'm a mom of 4, and my last birth was actually in a car. Crazy, but I learned so much from that experience. So let me give you a little bit of backstory, then I'm going to talk about how exactly I think you can push out a baby in a non-emergency situation and some of the other things that you might need in order to help that experience be even better. So my first 2 births, I actually had an epidural, and my last 2 births, I didn't. And I remember the doctor telling me, and you tell me in the comment section below if you've had babies and they told you the same thing, but I was delivering my baby and the nurses and the doctors were telling me to push the baby out by 1, taking a deep breath in, holding my breath, and then bearing down like I'm going to the bathroom. Like really like, oh, like push. I would never do that now. Never. Okay, that is so wrong. So anyway, that is what I was told to do when I pushed out my babies. And those first 2 times I had an epidural, so I couldn't really feel anything. However, for my 3rd baby, I was instructed to do the same thing, but I did not have an epidural. And so I felt this burning ring of fire when I was bearing down and pushing according to when I was instructed to push. Now, this was very interesting because I didn't have any monitors hooked up to me or anything like that. So at the time, they really couldn't tell me when to push, but they're like, okay, push now. And I'm thinking back now, like, how could you tell me to push now when you can't see the contractions? You don't know what my body is experiencing at the time. So when I was able to give birth in the car, I was able to actually intuitively know what to do. Now, think about this. No woman who has ever given birth in the car, like myself, wants to give birth in the car. Okay, so why is the baby coming? Clearly, I'm not pushing. So what is happening there? And how can you, whether you are in a hospital, a car, at home, wherever you are, in a non-emergency situation, having a vaginal birth, what can you learn from that? So one of the things you need to be aware of is the fact that your body has a reflex, a fetal ejection reflex. So once your baby gets into a certain position in the vaginal canal, it's going to press against certain nerves inside of your body. And those nerves are going to send that positive feedback loop of push the baby out. And you aren't physically pushing the baby out. Your body is pushing the baby out. You actually don't need to push at all. If you are in a non-emergency, regular vaginal birth experience, you don't have to push the baby out. You actually can sit back and watch the baby come out on its own. And I'm going to give you some techniques in a second on how you can help with that. So just make sure you watch this entire video. but you don't have to actually participate in it. You can be an observer of your own birthing experience. And for me, in that experience, it actually didn't hurt. And that was a huge eye-opening thing for me. It actually felt really good. It felt like a huge release, this huge influx of hormones. There was no burning ring of fire. The baby emerged out on her own. I did not push her. My body did the reflex, boom, and just literally shot her out of my body. Let me explain why I feel that that's a better way of birthing compared to physically bearing down and pushing out the baby when you don't have to. Obviously, in an emergency, if you have to get that baby out as soon as possible, bear down, push, you know, do what you have to do. But if that's not the case, I think you don't have to do that. So basically, what happens when you are taking in that deep breath and then bearing down, like you have to go to the bathroom, you're tensing up, right? You are tensing up your pelvic floor, your vaginal area, everything. It's tense because you're holding your breath. And that's actually like pushing back against what you're pushing out. So you kind of have this extra tension and resistance that makes it more painful, right? Creates that burning ring of fire and that tension. You don't want to be tense in that moment when you are pushing out the baby. You want to be relaxed. You actually are going to see a shift in your body. So when your body is contracting to open and dilate your cervix, you're gonna see your stomach getting like tight and release, tight and release. And your body's doing one sort of movement there that you kind of train for when you're doing different exercises to train your pelvic floor. Something that I actually showed and mentioned when I was pregnant on this channel. But one of those things is belly pumping, where you take a deep breath in, and then when you breathe out, you actually pull your transverse abdominis together, almost like you're pulling the muscles from one hip and the other together toward that belly button, and you're kind of pulling that belly button back toward the spine, and you are lifting your pelvic floor up. So it's kind of an in-up type of movement. Follow me? Okay. I need to do a whole entire birth course on this because I don't want to make the video too long, but that's the initial motion that you have going on. However, once your body is ready to push the baby out, you're in a new phase, your body kind of recalibrates because it goes from that sort of motion to a different motion of pushing it down and out, of releasing open and out, right? So you need to be mindful of that when you think of your breath and your breathing. You need to breathe out with kind of instead of when you are taking on the contractions, your breathing out feels a little bit different because you're still kind of pulling in and having that cervix dilate. But when it's time for you to push, that out breath really needs to be a release. Do not hold your breath, baby girl. Do not hold your breath. Breathe out, almost like in this meditative type out breath of right? Don't push. You don't even have to push. Just think open release of your body, right? Just open. And use gravity. If you can be upright. Now, positioning for birthing is a whole nother video because again, I don't want this to be too long, but upright, you want to use that gravity and you want to breathe out. Is nice doing the contraction. Is better when it's time to push. Okay, please write this down. Get your notebook, whatever you have to do. And take time when you are pregnant to prepare for that moment because it really is mental. You really want to stay mentally aware so that you don't panic, so that you don't start, listening to things that don't make sense to your birth experience. You know it makes sense, you know it doesn't. But you need to be present of mind because you have to think about these painful contractions and how to manage them and how to manage the pain. You need to be aware. The best way you can keep that awareness is by preparing yourself ahead of time, right? Just like preparing for a marathon or anything else we have in life that we prepare for, preparing for the pushing experience of birth is important too. Another tool that really helped me was smelling lavender essential oil. I have a whole video about essential oil during the labor stage, but I was smelling that, and I think that's something really good to do when it's time to push. Remember, you are not actively pushing in this particular situation. You are allowing your body to push the baby out. Allow it to do its thing. Now remember, there is a small recalibration phase when you're going from dilating to time to push. So just be aware of that, and sometimes it can just be a recalibration, and for other women their labor could have stalled. So breathing something like the lavender essential oil actually will help you keep that labor going and keep it from stalling. So just be mindful of that, but try not to get too nervous because it does have a little bit of a pause so they can switch to pushing, the pushing stage. If you absolutely feel the need to get involved with the pushing, remember, it's not like a bearing down, tense, don't hold your breath. Still use that out breath and just focus your abdominal area going from high to low and out. You are going to want to just have some nice music going, be relaxed, and think open and release. And that will help get that baby out and have a less painful. Mine actually felt good, so I'm really wishing that on every mom, for their labor to feel good and to be safe. And remember, no matter how your labor and delivery goes, all your births matter, whether you have a medicated birth, unmedicated, C-section, anything, all of it matters. You are a mom, and birthing is challenging. It is one of the most challenging situations we'll be in our life, but it's also one of the most beautiful. And I hope that my advice here today will help yours be a beautiful, wonderful experience. Please comment in the comment section below any questions that you have. I will love to answer it, and I'll give a little more information later on in another video about birthing positions and different things like that, but I definitely wanted to first start this conversation today here. And if you are not subscribed already, definitely consider subscribing. This is a community of super mom coaching where we pour from full cups and just try to be the best mom for our families every day, because we don't have to be perfect, but we just have to try our best with a lot of love. All right, I will see you in the next video. If you are a mom who is pregnant right now, definitely check out this labor and delivery playlist, and you can learn a lot of other information that could possibly help you on your journey.